Hi, are you a partner of somebody who's expecting a baby? And are you wondering how to best support them? So if you're wondering how best to support your partner with their emotional understanding and their physical needs during the pregnancy, then continue watching. So today we'll delve into how partners can support a pregnant woman effectively, both physically and emotionally. For you to be the pillar of strength and love for your partner's journey during the pregnancy, it's important that you understand what your partner is going through during pregnancy. Pregnancy is a time of profound change, both physically and emotionally. Physical changes start as early as soon as the woman falls pregnant, and it may vary as the pregnancy progresses as well. So it's important that you understand these changes so you can sympathize and empathize with the woman who is pregnant and support her better. Some of the physical symptoms that the pregnancy may cause is tiredness, fatigue, insomnia, bloating, vomiting, nausea, unable to eat or digest some certain foods, or smells which can affect them, and just general tiredness. There can be a whole shift in the landscape of emotions that may happen during pregnancy as well. And if you're able to understand that, then you could be a compassionate listener and implement the changes accordingly. A pregnant woman can be excited or sad or fearful or teary. If you can encourage open conversations and discuss both physical and emotional needs, that may help bond better during the pregnancy, and it may strengthen your relationship as well. Sometimes it's important just to be there. You don't have to offer active advice or active participation in their emotional roller coaster, but just being there as a shoulder of strength is really important so you can navigate the journey better. So far we have discussed the first part, which was understanding the changes of physical and emotional needs during pregnancy. So the second part is, how do you provide emotional support? Physical support, you know it, I don't have to say it. Emotional support. So the first thing is reassurance. See, your partner is going to be very emotional, very doubtful of everything that happens to them. Anxiety and fear will be heightened because it's the natural reflexes that is helping them protect themselves. So there'll be plenty of doubts that come across. It's important that you be there, and saying that you're there might just be enough to help them calm their fears and anxiety down. Second thing would be just being physically affectionate, because the woman's body undergoes a lot of changes during pregnancy. They feel very insecure about the bodily changes that's coming across. So to be affectionate just by simple actions like holding hands might enhance and reassure that you are there for them during this journey. A simple act of checking in every day to see how your partner is doing. How are you? How are you feeling? How is your emotional state? I think it's important to be just open and ask so you can communicate effectively and figure out how she's feeling and support accordingly. Lastly, respecting the needs. Not everybody speaks the same language. I hope you understand what that means, but it's important to fulfill what they want, not what you feel that you can provide. So it's really important that you make that subtle difference. So the third part is, we want to make sure that you understand what you can do around the house day to day to help progress this pregnancy journey smoothly. Firstly, sharing responsibilities. It can be as simple as cooking a meal or grocery shopping, preparing healthy meals. Not that you have to, but at least bringing in the nutritious food and planning will help. So the nutrition that goes into not only helps the woman, but also the baby. So concentrating on fresh, healthy food is important. Creating a comfortable environment by decluttering the space and making the space more open with light and air will help calm your mood down. Accompanying appointments together. If practically possible, that's the best thing that you can offer to your pregnant partner. That shows that your efforts and time is extremely valuable and that she is valued as well. It not only shows that you care for them, but also you can gain the knowledge about how to care for them during the pregnancy. The fourth point that we want to discuss today is educating yourself. Knowledge is a powerful tool. How can you educate yourself? Simple things. First, you can read books, There are so many wonderful books that are available about pregnancy journey. There are also many books about childbirth and the parenting books. Reading the books together and probably having a discussion will not only enhance your relationship, but also have some discussion about your parenting style. Attending childbirth classes, really important, that is offered to you either in your private setup or in the hospital. Simple example, there are many times when we as doctors come in to help with the birthing process. If you have that basic knowledge, it's easy for us to communicate to you during that stressful situation. But if you don't know anything, it makes the stress even 100 times bigger and worse for both you as well as the treating healthcare professional. So simple stuff like, say for example, I'm going to say that, okay, I'm going to do a vacuum delivery. If you understand that what vacuum delivery means, when we come back later during the postnatal period, it's easier to debrief because you've already understood the context. Sometimes there can be an emergency that occurs during the childbirth and we may have to call for help. When we press the button, you will see that there are about 20 people that walk into the room, which of course is really scary and you may panic. But if you are aware of that, then it makes it easy for us to perform the job during that time and then take it to the postnatal period where we can debrief you appropriately. Nowadays, internet is available at your fingertips. So you can do your own research online, but look into credible websites that by either the college websites or the government websites or your own websites that are reliable, and rely on that knowledge as well to develop your own knowledge. Point number 5, planning for future parenting styles. Because if you both are not on the same page as to how you want to raise your child, you're going to be played against each other. Beware of that. As mentioned before, there will be lots of unsolicited advice that comes with, but take what's important, what suits your style as well. Preparing for baby's arrival. Most common question that gets being asked in the day-to-day clinical practice, what am I supposed to pack or what should I do to welcome this baby? Creating safe sleeping space. Packing your bag with the essentials of baby clothes, your clothes, maternity clothes, as well as shopping for some essential needs that you may require during that time is important. Financial aspect of planning, really, really important. If you've not already discussed this, how you're going to manage your medical bills, when are you going to return to work, and how do you plan that return to work safely, both as a partner as well as the person who has given birth. So you can manage that as well as the childcare expenses. How are you going to manage them? Establishing a birth plan. Now, not everybody wants to do that or has to do that. It's not a hard and fast rule, but if you feel comfortable establishing a birth plan, please go ahead and do that. That just tells us your preferences of who can be around when you're giving birth, what sort of pain relief that you would like during the time, and what is your birthing preference position, and what's the birthing position that you prefer during your labor. Now, we can't promise that that will all be provided, but it serves as a guidance. The important thing is don't become too attached to that as well, because I've seen that lots of women who have a great attachment to the way the birthing plan has to work, unfortunately, it doesn't go well for them. So be open to whatever comes during pregnancy and labor, and learn to enjoy that journey and modify your thoughts around it so you can make it a pleasant journey. The last thing that I want to emphasize is looking after yourself as well. So a partner who's caring for a pregnant woman, it can be quite demanding on both your own physical and emotional needs. So it's important you look after yourself so you can give the best version of you to your pregnant partner. So what are some of the tips that you can do to look after yourself? Practicing self-care, again, eating healthy, walking, exercising, meditation, breath work, they can all help you. Staying connected, so constant communication, being open, stating the needs of what you want from each other will help reduce the stress and tension in the relationship. So your role as a supportive partner during this pregnancy journey is important and vital. And educating yourself as to how best you can support your pregnant partner not only creates a safe, effective environment, but also a calming and pleasant pregnancy journey for both of you. Thank you for joining me today. If you do have any questions, concerns, or seeking more guidance, you can always visit us at athenawomensclinic.com.au. We would love to support you and be there for your guidance.